Deaf multilingual children, professionals' perspectives on supporting families. Who is a deaf multilingual learner? They are children and students with hearing loss who may be bilingual, trilingual, or even quadrilingual. They are learners who may need to learn an additional language or languages to access formal education in the region that they live. They are learners who may be monomodal or bimodal bilinguals using 2 or more spoken languages, 2 or more sign languages, or a combination of spoken and sign languages. Therefore, a deaf multilingual learner is a learner who has a hearing loss and is exposed to and or learning 2 or more languages, regardless of the modality of these languages. So when it comes to making decisions about which language or languages a deaf learner will use, a lot is involved in making that decision. But most importantly, this choice must be an informed choice. This is a choice that's based on parents receiving unbiased information about all possible options and understanding what these options can mean for their child and their family. And professionals aim to support parents in making informed choices. And while there's quite a bit of information about how hearing parents of deaf and hard of hearing children make decisions about communication mode, we know very little about what parents consider to be important when they're making decisions about spoken language multilingualism or signed language multilingualism. And to my knowledge, we don't really know anything yet about parents' decisions when they're deciding about whether to use 2 or more than 2 sign languages. So we're going to focus here on spoken language multilingualism. We know from past research that advice to professionals is very important in parents' decision making. But we don't know what professionals are saying. Anecdotal reports from parents that are reported in the literature and anecdotal reports from the parents I work with and from parents that my colleagues work with have given quite a clear picture though, which is speak English. So then what happens when we ask professionals about what they're saying to families of deaf multilingual learners and how they support deaf multilingual learners and their families? We recruited 19 professionals with experience working with deaf multilingual learners in Australia. The professionals had between 4 and 37 years of experience working with deaf and hard of children and worked in roles such as speech language pathologists, teachers of the deaf, and psychologists. 6 participants were monolingual, 11 were bimodal bilinguals using a spoken and a sign language, and 3 were spoken language multilinguals. 1 participant was deaf, bimodal, and spoken language multilingual. And these professionals participated in focus groups or interviews discussing their experiences working with deaf multilingual learners and their families. So current monolingual language skills were described as impacting on the expectations of future multilingualism. This professional said, his overall language skills are improving, and then the parents felt that they had some confidence of, yes, he might be able to learn to speak Arabic as well. But the opposite was also true, with poor current language skills discouraging hopes of multilingualism. Code switching is an important metalinguistic skill for multilinguals, and one in which professionals described young deaf multilingual learners to be adept. The advanced metalinguistic skills of deaf multilingual learners with additional developmental challenges was also described. This participant said that a child, she signed to dad, she talked English to me, she talked Telugu to mum. Autistic, she just knew how to code switch. Effective and timely audiological management put deaf multilingual learners on equal footing with hearing bilingual children, whereas late diagnosis and later access to intervention were associated with difficulties. Adding sign languages was also a valuable strategy. This professional said, so there were 2 spoken languages sequentially, and then Australian Sign Language. Not surprisingly, Auslan has blossomed, and she's really picked that up beautifully. And it's now flowed on, impacting on the spoken languages, and they're starting to develop. Additional needs had a negative influence on the possibility of deaf and hard of hearing children becoming multilingual. However, the opposite was also true. This professional said, my experience has been that if children are just deaf and we're not dealing with cognitive delays or other issues, then learning 2 languages at the same time is not necessarily a deal breaker by any stretch of the imagination. Information was also mentioned as important for supporting and negotiating language for families. Professionals reported that parents had many preconceptions about language and the views of professionals. Most often, this was that English was essential and that monolingualism was the only possibility for a deaf or hard of hearing child. For example, sometimes parents need to be convinced about that. Parents will say, but he's got a cochlear implant, he can't be bilingual. And so I'll say, why not? Professionals provided parents with information about multilingualism, reassured parents about their choices, and used information to dispel myths, preconception, and misinformation. Information provided to parents by other people was important, although this information was often seen as misinformation. This professional said, there have been families that have come in and said, Dr. Such and Such said he'll never learn our home language. And I'm like, who is he to say that? That's not his field. Pipe down, Dr. Such and Such. The different roles that languages play in the lives of families and the way languages are viewed in these different roles was raised by professionals as important to negotiating supporting languages. Many professionals commented that the skills of all family members was important. Interestingly, multilingualism for recreational purposes was also mentioned. This professional described a child and said, he knows English, he knows Auslan, and he's learning French quite happily because that's where they go on holidays. The role that language plays in society was also discussed. While parents may feel English is a priority because of its role in society, professionals were more cautious. This professional said, so there's no point having your values and going, look, you live in Australia, English is the most important language, when you're dealing with a parent who's not a native English speaker and who has very low English skills. Planning for the transition to preschool and then to school often brought about a shift in language choice and priorities. The professionals described parents as perceiving as an emergency. And the focus on English was described by professionals as parents yearning for their child's academic success. Professionals also discussed the role language had in identity, and this centered around three ideas: belonging, culture, and bonding. Professionals discussed the role that different stakeholders have in making decisions about language for deaf multilingual learners and their families. Shared leadership was often described in terms of expertise. One professional reported she'd said to a parent, I don't speak a word of Hindi, so you're going to have to be the expert on this child's Hindi development, and I'll be the expert on English development. Leadership by the family was described in several ways: autonomous decision-making by families, leadership being placed on families, supporting parent leadership, and conflict with parents. Ideally, situations were like this. A professional said, those discussions were very much family-led for me, and I basically am scaffolding the parents to talk through what they're really looking for and they're wanting. Professionals also describe parents explicitly placing the role of leadership on the professional, such as some of them, parents, say, you're the expert. I'm here because you're the expert, so you'll tell me what I'm supposed to do. They just defer back. Considering parents' language skills was viewed as an important and challenging aspect of professionals' work with deaf multilingual learners. For example, this professional said, they are all trying to learn Auslan, but then they were also trying to use their own first language from home, and they're trying to learn English as well. Several professionals described parents' comfort with the language they were using with the child rather than proficiency as their paramount concern. One said, I'll say, what's your joke language and what are your love words in? The logistics of language with the child amongst the family and outside the home was also important. One frequently mentioned strategy was the separation of language by person. In this case, the dad speaks Bengali, mum speaks Moroccan Arabic, but they speak to each other in English. So when the child's alone with mum will speak to the child in Moroccan Arabic. And when Dad's around, everybody speaks English. Place-based divisions of languages were also most often between home, education, and community. For example, whether it's story time at the library or a playgroup or a music group or whatever it is that the English is coming from, it's somewhere else, from a better language model. Professionals also describe strategies to increase the quantity of a language that deaf multilingual learners were exposed to. Timing of decisions was important. Professionals describe working with parents who are making decisions extremely early in their child's life. However, families' plans for multilingualism often fell away over time. Families sometimes start off with good intentions for a second spoken language in the household, but don't always keep up with it and just go with whatever is easiest. The need to revise decisions was also important for professionals. So professionals said, so it might be that the parent is sitting there going, oh, well, there are options. So let's try this one for a while. And there are options in terms of changing. We're not signing ourselves up for the next 12 years worth of my child only going to speak Mandarin at home. Participants used research as a tool for self-education and changing their own practice, and drew on research describing typical multilingual development, monolingual deaf and hard of hearing children, and children learning English as an additional language. A lack of research was also associated with frustration. I often find when I'm looking for something, trying to follow a question, what there is in the literature just doesn't fit. I get frustrated with that. Professionals reported that their own experiences of multilingualism informed their work with deaf multilingual learners and their families, whether they were themselves multilingual or not. Professionals also commented on the importance of knowledge held by others, including those who were specialists in supporting language development in deaf and hard of hearing children, and those who had other specialties. This professional said, you've got general pediatricians who may have no idea. Different people have conflicting information. Parents and interpreters were described as resources professionals could use to access specialist knowledge that they lacked, particular language and culture-specific information. For example, one professional said, you can ask mum to say it and you can transcribe it and then listen to what the child is saying and then compare it this way. So, professionals shared information and clinical materials that they considered to be hard to find, which had helped them in their work with deaf multilingual learners. Other cautioned that resources which may appear to be appropriate may be less helpful than they seem. For example, this participant said, we've ordered in this test in Chinese, but culturally it's not appropriate. Just the words that are in that tool are not the words that we would use here. So what does this mean for our practice? First, multilingualism is a possibility for many children with hearing loss. This needs to be kept in mind because the possibilities for these children are changing. And as parents and professionals, we don't want to stifle these children's potential. Second, remember that parents and professionals consider different things to be important in decision making. So clear, open, and continuous communication is critical. Finally, the lack of evidence-based practice guidelines for recommended practices with deaf multilingual learners and their families means that professionals need to draw deeply on their own clinical expertise, as well as the expertise of their peers, to work effectively and create positive outcomes for deaf multilingual learners and their families.